There has been a lot that happened from the previous Congress to our now Cape Town Congress. And what happened in the geopolitics will definitely influence global health and what we are doing there. I think of the power shift that we have seen that influences global health as well, and strongly we see some of the hegemonial powers stepping out and others will come in, other players come in, and I think during this Congress, I want to have really the voices of the other important players in the global health field at the forefront. That is what I would like to see most importantly. I think I still remember what happened to me in my very first Congress. I was quiet, absolutely only looking, listening. And it took me some time to come out of this passive role. What I would like to say to first-time attendees, try to be an active member from the very beginning. What could you do? I mean, you could, for example, approach people that you felt were interesting or you would like to know more about by asking them, can I ask you some questions for my social media account so-and-so? Would you be able to answer them for me? It's a nice way to approach people, and I think a lot of them will be absolutely open to this. You can also go to clearly small sessions where the networking is far better, but think of the way that fits to your psychology, how you can be active, how you will enter into contact with other people, other researchers, advocates, and so forth. This is a very important part of every Congress. It's not to be passive, but take an active role, and take this active role during coffee breaks, in smaller discussion sessions, or why not dare to ask a question in the big auditory. I know it's not easy, but try it. You will be really, really surprised how that feels. Well, South Africa, is a historical place for public health, for global health. South Africa has been so important in the AIDS movement and in negotiating AIDS drugs. And we have to learn from South Africa and our South African colleagues a lot about successful advocacy, about how they manage, how they're dealing with nowadays problems and the still existing AIDS pandemic. But we have, in addition to South Africa, the amazing colleagues, the amazing health questions in South Africa. We have the whole continent full of amazing countries. And we hope to get as many attendees as possible from African countries and learn from them. I know that they are so different, these African countries, that everyone brings in a learning that I haven't heard yet. I'm always surprised what I can learn. And being in South Africa on the African continent, I think it's a great opportunity for the global health community to learn from our peers, to discuss with our peers in both South Africa and the African countries. So I'm looking very much forward to this experience. From now on till the Congress, there still is a year, and as we know, things are moving quite fast. We will try to integrate what happens in global health during this year into the Congress, but also into the final takeaway, take-home messages. But one thing for me is not negotiable. I will call on us as public health people to remind us of the important task we have. We are here to combat and to go against hatred, against wars, against conflicts, and to make everything that we can to stop unnecessary suffering in this world.